Okay, now we are live. So, hello everyone, and thank you so much for joining us for another session with WebSeth S. And today we are joined by Dr. Michi Bon, a general dentist practicing in Malaysia. So, thank you so much for joining us, Dr. Bon. And whenever you're ready, the floor is yours.
Hey, thank you, Kim, and thank you, Dr. Jaebong Park, for the invitation to participate in this virtual shadowing session. Such an honor to be invited by Dr. Jaebong Park. I'm Dr. Bon Mei Chi, and I'm a general dentist in Malaysia. So I'm actually always glad to share my experience and passion in dentistry to others. And I hope you are able to benefit and learn something new from this virtual shadowing session today. I try to make this presentation as fun and relaxing as possible, hoping that none of you will fall asleep during this session. And I currently practice in an amazingly beautiful city, Kuala Lumpur, this one, which is also the capital city of my country, Malaysia. And a little introductions about my beloved country, Malaysia. It is a tourist attraction with its iconic building here. You can see here in the picture. We name it as Petronas Twin Towers, and it is recognized as the tallest twin towers in the world. And Malaysia is one of the most important tourist destinations in Southeast Asia, which is one of the developed countries that cares about its heritage and history. Malaysia is also a multicultural society of which the population is made up by different type of ethnic groups, includes the Malays, the Chinese, Indian, and the native. And different ethnic groups have their own history, has their own culture, belief system, and values. And because of the mix of culture, it has made Malaysia a paradise for food lovers. If there's any one of you who have planned to visit Malaysia after reopening of country borders and after this pandemic ends, please do not hesitate to slide into my DMs and I will provide you with lots of information regarding the best tourist spots and nice food in my country. So back in 2012, I got enrolled into my dream university in Malaysia, University of Malaya, to pursue my bachelor degree in dental surgery. And the reason it is my dream university because it is actually the oldest and also the highest ranking Malaysian institution of higher education. And my faculty, which is Faculty of Dentistry, is actually the first, the premier's and the oldest dental school in Malaysia. For now, University of Malaya is currently ranked 59 in the prestigious QS World Ranking 2021. And in order to get into this Faculty of Dentistry, University of Malaya, I strive to get good grades during my high school and also pre-U studies. And besides scoring in academic, I involve myself in extracurricular activities involving voluntary programs, music and sports events, so as to increase my chance of enrollment into my dream university. And no doubt, involvement in extracurricular activities are actually crucial, even to you, I think, in your university to get into your dream university, as it is a good indicator of your future contributions to the campus community. And for this, I graduated in 2017 after completion of 5 years of dental school. And I had lots of fun during my dental school days, just like everyone else. I carry out dental research. I involve myself in student bodies and dental conferences and also organizing lots of dental events too. And besides hustling with dentistry, I actually also joined other programs held by other faculties, such as these music faculties and also the sports science faculties. I joined their song composing competitions, their singing performance, and also some other sports events as well. And because of me joining all these programs, I actually met lots of friends, and I had lots of fun. And I can say 5 years in my dental school is one of the best time of my life. So I hope you are able to enjoy dental school as much as I did. Go create memories with your friends and meet best friends, unleash your potential, and be bold enough to take up challenges. So even till now, I'm actually picking up my singing hobby. And currently, I'm actually growing my social media account as a singing dentist. If you follow me, you will know I post a lot of singing videos and also dental videos as well. If you are very passionate and enthusiastic in dental public health, actually social media is a very good platform and a powerful tool for you to venture in that field, such as on Instagram, on Twitter, on Facebook, and also on TikTok. You are able to share your thoughts and also your dental knowledge to the public worldwide. So in Malaysia, after graduating from dental school, we actually need to undergo a 1-year compulsory service with the government. And after a year, we are actually able to choose to either join the private sector or to stay for another 2 years to get a permanent posting as a dental officer in the government sector. We are actually not able to enroll into any residency program immediately after we graduate from dental school. We will actually need to have to work for at least 2 years before we are qualified to be selected in the residency program. So as a general dentist, I do most of the dental procedures in my clinic, such as aesthetic dentistry, orthodontic treatment, minor oral surgery, pediatric dentistry, endodontic treatment, dental implants, prosthodontics, and also periodontics. So to improve and widen my knowledge in dentistry, I also sign up for some dental courses here in Malaysia, such as implant course and orthodontic courses. Okay, so come to the dental topic of the day. I'm talking about the non-carious tooth surface loss, which is one of the most common oral health problems faced worldwide and also in Malaysia here, regardless of the cultures and races around. So non-carious lesion of teeth is as widespread as tooth decay. It will cause sensitivity of teeth, gradual tooth loss, alteration of bite, and in some cases, it will affect the aesthetic of the smile too. So there are these 3 most common type of non-carious tooth surface loss in Malaysia, which is the first one will be atresia, second one will be abrasion, and third will be erosion. So I'll be talking about these 3 in my next slides. Okay, so this one, the first one would be atresia. So you can see atresia is defined as the loss of tooth substance caused by mastication or contact between the occluding surface. So the main etiology of atresia in Malaysia is actually parafunctional habit, such as, if you know, bruxism or clenching, and constantly chewing on provoking substance such as bitterquid. So I think bitterquid should be something new for you. It is actually a tradition and a popular cultural activity in many Asian countries, including here in Malaysia. So a bitterquid is it generally contains bitter leaf. You can see here, areca nut, slaked lime, and also tobacco. It is very addictive, and excessive use of bitter nut can actually cause intoxication of the body too. And this habit actually has been associated with a very high risk of tooth atresia, high risk of tooth loss, and also even oral cancer. So you can see the severity of the atresia here by bitterquid chewing. Okay. So secondly would be abrasion. So abrasion is defined as the mechanical wear of tooth from interaction with objects other than the tooth-to-tooth contact. It most commonly affects the premolars, you can see here, the premolars and also canine, as they are more prominent in the dental arch. And usually abrasion happens along the cervical margins. And in Malaysia, it is mostly due to incorrect tooth brushing technique. When we brush too high, using too high amount of force during tooth brushing, and also we use the incorrect stiffness of bristle use. So supposedly only soft bristle toothbrush is actually recommended for tooth brushing. You can't use the medium one, you can't use the hard one too. So I've seen a lot of patients who use medium and also hard toothbrush, and apparently they are more prone to having this higher risk of tooth abrasion. Some abrasion cavities are too deep that the pulp is exposed, and the teeth will end up needing root canal treatment or extraction. So there's this video I post a poster on my Instagram demonstrating the correct ways of toothbrushing using a more fun and relaxed way. And I hope you enjoy this video. It is actually in Mandarin, but there's a subtitle there below there. So I hope you enjoy this video, right? 麻烦给我的朋友来一支新牙刷，不能用硬毛的，只能用软毛的。而它的牙膏既不用太多，这分量已足够把牙齿刷干净。把牙刷倾斜在45度的位置，轻轻地颤动，顺着牙缝上下刷。牙的咬和面也要来回刷。牙齿内侧和舌头也要记得刷，这牙膏泡沫吐出来不许漱口，用清水漱口会把腐给冲走。早晚刷2次，每次2分钟，这是世上最干净的那排牙齿。还要用牙线清理牙缝间，这是世上最美丽的那排牙齿。Okay, I hope you find it enjoyable. Kim, I also hope you find it enjoyable as well. Okay, so these are the things that I do on social media. Besides sharing about dental knowledge, I actually make it a more fun way and an interesting way, so people would actually engage to it and watch it and actually learn something from it, from my video. Okay, so next, okay, I'll be talking about this erosion. So this is the third most common non-carious lesion in Malaysia. So erosion is defined as the dissolution of tooth structure by acid. And acid can actually originate from intrinsic source and also extrinsic source. So from intrinsic source, which is can be the hydrochloric stomach acid, and it reaches the mouth from vomiting and from the acid reflux and from voluntary rumination too. So acid can also originate from extrinsic source, such as your diet intake, lemon drinks, the acidic carbonated drinks, sour foods, and etc. So Malaysia is actually a multicultural country here. So hence we have actually varieties of food here. Malaysians love taking sour food and drink, including myself. But fortunately, I don't have eroded teeth yet for now. So these are the popular sour food which you can find here, okay, in Malaysia. So this is what we call the asam laksa. You can see it's actually spicy and sour as well. And this is what type of fruit here, which is popular here in Malaysia. This is called the buah kedondong. The buah kedondong. Okay, so this one will be the asam fish, which we pour the asam sauce, the sour sauce on top of the fish. Okay, and also this is what we call the achar, the pickled sour fruit here in Malaysia. Okay, so I guess that's all for my sharing today. And thank you for being here with me. And thank you, Kim and Dr. Park, for inviting me for this meaningful virtual shadowing session. And I hope you learned something new today in this session. And now I'm open for the Q&A session. Yep.
Wow, thank you so much, Dr. Bond, for an amazing presentation and some yummy Malaysian foods. I love that.
Oh, have you tried it?
No, but I really want to now. Yeah.
Okay, can come to Malaysia. I'll bring you around.
Thank you. So we do have a couple of questions. So to begin, so we saw that you were very active on social media, on TikTok and also Instagram. So how did that play a role in like dentistry and like advertisement of your clinic?
Okay, so because now I'm actually practicing in a private clinic, so some marketing is important to to sustain your business and to get more people to come into your clinic to know you. So you don't need to actually advertise about your clinic that much. You just do what you like. You just post about some dental knowledge, and oh wow, you will get some engagement from the public. And then we actually, the public will actually come and approach you and ask, oh doctor, I actually have this problem as well. So how can I fix it? Something like that. So besides publicizing about your own dental clinic or your own reputation as well, you can also help the patient to identify their problems, which maybe they didn't even know about the problem that they have. So I think it's a win-win situation to make videos and to for this dental education on the public. Yeah. Yep.
Thank you for that. So next we have, do you have a favorite dental procedure to
Oh,
perform?
yes, of course I have. Actually, I love doing lots of surgery. I'm actually a very bloody person as well. I follow lots of those Instagram dentists, Then one of it would be the bloody tooth guy. I don't know whether you know him. So every night before sleep, I will actually scroll through his Instagram and look at all the dental procedures before I can sleep. So it will be minor oral surgery, which I love the most. Is one of the best dental procedures for me. Yeah.
Thank you. So what would you say is one challenging aspect of general dentistry?
One challenging aspect. Okay, so as I'm a general dentist, I'm not into any residency program. I'm not like specializing in any what we call specialty, such as like prosthodontics or oral surgery, things like that. So I will need to actually do all the procedures, such as what I've shown in my slide. I need to do cosmetic dentistry, aesthetic dentistry, and all sorts of procedures. So I think it's a challenge for me when the patient come and I will need to address all his problems, and not just like, oh, if you are a specialist, you are just address, there's someone as another dentist who will refer the case for you and you just treat that problem only. So I will need to actually explain to the patients everything, not just about one aspect only. I'll need to explain full aspect, and and at last eventually he will need to know the full treatment for him, maybe the gum problem and also the problem with his teeth, the biting, everything. Yeah, so this is quite a challenge as a general dentist. Yeah.
So how did COVID impact your business and your life as a dentist?
Yeah, actually, for now, COVID has actually made quite an impact on this business of my private clinic. So, and because of this, I have actually more time to do my videos and to do some shootings in the clinic as well. So I think it's not a bad thing. And also, of course, because of this COVID, patients, they are not they are quite afraid to actually come out from the home, from their house, and they only come to the clinic when they really have some problem like toothache or some wisdom tooth problem, some gum problem, which cause them pain. So of course the business is actually the business flow is actually reduced, but I can see for now it's actually increasing. Like people is actually people they are like coming out now and to seek for dental treatments slowly lah. Yeah. Mm.
Thank you. Um, so how did you motivate yourself in dental school when times were hard to keep moving forward?
Oh, so this is a very good question from you from the floor. So dental school is actually very stressful. We know, everyone know, we need to stay after 5, maybe we need to stay in the lab to do our lab works, everything, and sometimes we tend to skip our dinner as well. And when we reach our room, it will be around 8 or 9 at night. I'm not sure, is it the same there in any other dental school, but it is here in my dental school. So I because of this actually um how I manage myself was by joining all those you can see I joined those activities such as singing activities, jamming with my friends, and also play some sports activity as well. So all these actually they are my hobbies, and even until now I still play like badminton. I still sing on social media. I still jam with my friends. So this is actually one of the things that you can do. Besides hustling with dentistry, you can actually find something that you like in your college or your university. I think it must have something else that you can do besides dentistry, something else that you like, such as maybe some sports events and some social, what we call this, society events. So don't just fix yourself just in dentistry. You need to go out and meet friends, and when you have more friends, you'll be happier. Yeah.
Thank you for that, Dr. Bond.
Yeah.
So do you have a special studying habit or a studying technique that you use in dental school that you were successful with?
Okay. So for me, I think that the most important thing about studying, like I can say this as a study tip for you lah. So for me, if I want to study, I will focus on my study. Okay, just like maybe you say, oh, I study for 4 to 5 hours to study. Why I can't absorb the points? Why I still can't remember? Because maybe in that 4 to 5 hours, you don't really what do you call, concentrate in that 4 to 5 hours. Concentrate on your study. Maybe you're like pressing your phone. You were on social media. You were talking with your friends, things like that. So during my study, I actually, if I say I want to study, okay, I will put just 1 hour. So in that 1 hour, I study. I don't, I don't go to press my phone. I don't get distracted. So in that 1 hour, I just focus on my study. So instead of studying for 4 5 hours without any input, I actually focus my study like just a short period of time. And you can take the next hours to do some other thing else, such as to meet friends, to talk to your friends, or to play some sports, things like that. Yeah. So that's my study tips lah. I hope it helps.
Thank you for that. Yeah, it helps. Thank you.
Yeah.
So did you face any pressure from your family to pursue dentistry?
Oh, this one, of course, my family is very supportive. Even till now, they still support me to go for those courses. Like for now, we need to go for those dental courses like implants, ortho courses, and surgery courses as well. So I'm very fortunate that my parents and my family are actually very supportive in me pursuing dentistry. Yeah. So support from family and friends are also important as well. Yeah.
Thank you. So this is probably going to be our last question, but what
Okay.
is your favorite part of being a general dentist?
Favorite part of being a general dentist. So, okay, as a dentist, we actually don't just treat the disease itself. We actually treat the patient as a whole. Okay, so not we don't treat patient as whole, HOLE. We treat patient as WHOLE, the whole perspective. So I feel that when patient come to me, I'm actually enjoy talking to the patient more instead of uh, doing the treatment. Of course, I enjoy doing the treatment, but the part that I like the most is I'm able to talk to the patient, and the patient is able to open to me and talk about his problems or that. And sometimes it's not just the dental problems that they are telling me. They are talking about their life, their family, things like that. And I feel that it's a very warm thing to have connection like this with patients and not just connect to their teeth or gum or just gum. So I'm actually a very sociable person. So I love this kind of connection that dentistry gives to me.
Thank you so much. So that's all the question we have for today. So once again, thank you so
Okay.
much for joining us, Dr. Bond.
Welcome. Thanks a lot for having me here. And I hope you guys are staying safe there during this pandemic. And I hope to see you soon. And come to Malaysia if you really like to have a visit here. I will bring you around.
Thank you for that. And also thank you for
Okay.
everyone who joined us today on our YouTube live stream. As always, the post-session quiz will be accessible through our website. Just a reminder that today's session will only be counted for 30 minutes. And if you guys need help accessing the post-session quiz, we have a short tutorial video on our Instagram and YouTube. So check that out. Anyways, thank you for joining, everyone.